Good morning. We'll get started. Thank you all for coming. So today we have Dr. Shreya Trivedi from NYU. Dr. Trivedi is a general internal medicine fellow in the Population Health Science Scholars Program and a candidate for Master's in Health Professionals in Education. So she's chief executive of the Core IM podcast. Anyway, I don't know if anyone else has listened to it. As well as lead correspondent of the Curbsiders podcast. And she has spoken about her mission-based use of Twitter nationally by the ACP as well as SGIM. So thank you for joining us.
Hello everyone, thank you for joining on this wonderful, today's Thursday morning. I know time is 3 today. It is such a pleasure to talk to you about something that's kind of grown with me over time. Honestly, 2-3 years ago, if I'm being very honest, I actually didn't even know what Twitter was. I thought like this was just a playground for the president. I thought it was where people get their celebrity news. And little did I know. And so I kind of want to share with you some of my insights or my perspective on Twitter. And I welcome kind of your thoughts as well. And I'm excited to kind of have a discussion about it. But I think for us to, it's like everyone kind of thinking in the back of their mind, kind of like, what is your academic mission, or what are your values that you bring every day to work that is really important to you? And I'm asking you to think about this because I think having that in the back of your mind as I'm talking about Twitter will kind of help you gauge how you can use Twitter. Because it's really like you can really make it what you want it to be. So just having, what is it that drives you in medicine in the forefront of your mind will be important.
Slightly closer. That's fine.
Yeah, if it needs to be closer, just let me know. So nothing to disclose. And just want to preface 2 things before we get our feet wet. One, there's limited data in this kind of realm. I think a lot of us are perplexed on how to really measure the impact of Twitter, especially when the target population is really dispersed around the world. And then despite the title of the talk, the number needed to tweet is not an exact defined number yet. It really depends on your mission. So we're going to start off today with kind of situating us in the same shared mental model of what is social media. And then we're going to have some honest conversations about some hesitations and myths about Twitter. And then we're going to spend the majority of our time thinking about what are the different ways to engage with Twitter. And then last but not least, I hope to really kind of empower you with 10 do's or don'ts about Twitter. And I think either if you have a Twitter account or if you don't, I think it will be at least give you some food for thought. So if I asked all of you what is social media, I think each of you would have a different answer or perspective depending on kind of what your experience has been in the past. I think for us to even have a productive conversation about this, I think we all need to kind of be on the same page about what exactly it entails. And so I think a lot of us are familiar with the social network aspect of social media, where it's basically a broadcast medium, like, hey, here's what I ate for lunch today. Here's the vacation I went to. This is more like, I think, Facebook and Instagram. And even on Twitter, it's like, hey, here's a conference I went to, right? It's more like, here's what I am telling you. Like, this is very much about me. And then within social networks are these virtual communities. And I say within them because it does require a little bit of you putting yourself out there. But the goal is very different. The goal is kind of a larger shared purpose or a larger shared mission. Some examples of that are kind of like I Am Focus, the ultrasound community, or cardio Twitter. And then even within these virtual communities, there's a small group of kind of what's called digital scholarship. I'll get into that a little bit later, but people who are really using Twitter to teach thousands of people and creating scholarship around it. The second way I want to situate us is just for everyone to think about, before the digital age, how do we disseminate or receive information? And I think if we think about how knowledge was mobilized, the gold standard has always been kind of, let's take advantage of our physical community, right? Like in a classroom, let's talk about kind of the new studies that are going on, or let's go to national conferences and give workshops, also with journals and kind of publishing articles. I think now with the digital age, there's all these virtual communities where people are sharing knowledge via blogs and podcasts and Twitter. And I'm not saying that the gold standard is going away anytime soon. It's still very important and has its place. But I'm just saying that there's now different ways to also share information. And so with Twitter in particular, it's really given us an unprecedented opportunity to share our mission in a pretty large scale way, and some would even say in an efficient way. But none of these platforms are perfect, right? And they're just platforms, there's mediums. And so I think we should be honest about the pros and cons of each to really kind of look at how to really engage with them. And so if we look at the peer review process, articles are pretty straightforward. There's usually 3 peer reviewers. Classrooms, not really a review process, but there's some selectivity about the speakers we choose. With Twitter, it's really a double-edged sword. In one sense, there's the democratization of voices. Marginalized voices can be heard just alongside other people. But in some regards, the negative of that is any Joe Schmo can just pipe it, right? And on the flip side, someone can say something really important, but it could get diluted in a long thread of tweets. And so it really kind of leaves it up to the Twitter community, that post-publication review, to really either autocorrect something that was incorrectly said or to really amplify that important message. The format of articles is usually straightforward. Classrooms, it really depends, but it's got to be synchronously at the same time. And with Twitter, you have a limit of the 280 characters. You can be really creative in linking threads with either, what we call like a med thread or a tutorial. And so you have a little bit of flexibility there. In terms of time to dissemination, in articles, it can really get lost in terms of months to years in the peer review process. In classrooms, it's really about what is that allocated time in the curriculum you have to disseminate that information to that physical community. With Twitter, there's this idea that there's this instant time for dissemination, but really the more meaningful content on Twitter can take quite a bit of time to construct, especially if it's kind of linked with a really great infographic. In terms of the social component, it's really limited in terms of articles, and with classrooms, it really depends, but oftentimes, unfortunately, in medical education, even like today, it's very much a unidirectional didactic. And with Twitter, there's like a built-in engagement process. Articles really varies in terms of impact. Classrooms, it's really about, it could be really impactful, but it's really only for those that are present. And then with Twitter, the potential is to reach tens of thousands of people. So my takeaway for this kind of first kind of situating us is Twitter is just a vehicle. It's not a destination. And there's 2, I think, main points in that. One, it's a vehicle, just like a writing platform is a medium for you, just like teaching in a classroom is a platform for you. And so kind of to think about it in that way and demystify kind of it being as like a vague social media thing, it's a vehicle just like any other mission you have. And the last point, it's not a destination. And I bring that up because I often think that people think like, okay, everybody has to be on Twitter now to say like, look how advanced our faculty is, look how like visible they are. But it's really not the destination. It's really about kind of what you're doing with that vehicle that makes it meaningful. So with that being said, you're kind of like, okay, great, Shreya, I understand this is another tool in my armamentarium, but I'm still not sure about this. And that's okay, because if you're still not sure, you're not alone. I think the number one thing that people say are like, okay, it's going to take too much time. I'm already doing so much. I'm so stretched thin. And so to that, like Dr. Ratcliffe, he's a clerkship director at Texas. He says he schedules in social media time limits just like anything else. A lot of people also say that it's more productive than Facebook. And this is very true for me. It's kind of replaced any Instagram or Facebook in a very productive way. Dr. Sachs, who's a ID specialist at MGH, and he says he disables all those push notifications. He limits it only to desktop and laptop use, and if that doesn't work, he actually deletes the app from his phone, and that's actually true for me. I actually don't even have Twitter on my phone. It's really kind of when I want to go on Twitter, I go on it. I think a lot of other people say like, oh, well, it's just a numbers game, and I think it's pretty hard with social platforms to not get kind of carried away with the numbers, like, oh, look how many followers I have, or that. But I think particularly medical Twitter is a little different, where I think a lot of us recognize it's more about the quality of the content and the conversations you engage with, not the number of followers you have. And I think that's also why it's so important to have that strong sense of purpose and mission, that you don't get carried away with, oh, this is the number of people who are following me or the people who are liking me. I remember, for example, one of my first tweets got 2 likes, just being like, wow, 2 people like something I have to say. And I had to kind of like shush myself and say, no, Shreya, like, my mission is to be on here to learn something new, to be inspired or to inspire someone else. And like, did I do that this week? And kind of continued that kind of mission and not get focused on kind of the superficial numbers. I think the last thing that people say, I think for this is more senior people, they might say they don't see any apparent value for them to be on Twitter. And I think to that I say, you don't know the possibilities until you engage. Especially, I can understand, like, if you're already in a leadership position where you're already having a great reach, you're already making the impact you want, you might not see the possibilities. And this is an example of Dr. McGill, and he's at Penn State, he's one of the head of their QI. He says, this whole community has made me a better teacher, a hospitalist, and given me a whole new medium to educate through. Then he says, I will attest how much it's helped me through burnout recently too. And this is just one of many people that say that after joining Twitter, they found passion in medicine again. So why are so many people saying it's making them into a better clinician, or it's giving them the opportunity to really amplify their mission or to learn from others? And so I think the low-hanging fruit in terms of the opportunity is it's a place to really promote your work. And there's some evidence to support this. This is from the Journal of Mayo Clinic Proceedings, where they randomized articles to no social media and social media. They were pretty good about, like, the types of journals that were randomized and the content. And when there was no social media, there was about, on average, 300 or so website visits for those articles. When there was when they were published on social media, there was about 1,500 or so. Now, website visits don't really matter much. Do people actually read those articles more? They weren't able to obviously track that, but they were able to track how many people actually clicked on the full text article download. And so, of the 300 or so website visits from the no social media arm, about half of them actually led to full text downloads. From the social media arms, of the 1,500 people that visited those websites, on average, actually a majority, about 1,400 of them actually clicked to see the full text download, which is great because, I mean, if you're going to spend your blood, sweat, and tears writing this article, why not do your best to make it as visible for people to learn from your work as much as possible? But I think we also have to take this with a grain of salt because this is showing the reach of the Mayo Clinic Proceedings social media, and you might be sitting there being like, well, I don't have much of a digital presence. How does this generalize to me? Or maybe you're shy about promoting your work, right? Like, it feels odd to be like, hey, look at this cool thing that I've done. And I think as medical people, we're more on the humble side. And so to that, I say find your person. Actually, people around the country are kind of doing this within their institutions. They're finding a colleague that's kind of their amplifier, I would say. This is a classic example from the Oregon Health Sciences. Dr. Durfstall is really passionate about ultrasound, and Dr. Oglasser is really passionate about pre-op medicine. And actually, they've only been active on Twitter about a year or so. It's been fascinating to watch their journey and their careers kind of skyrocket because anytime one of them publishes an abstract or publishes a paper, the other one's the first one to kind of amplify and say, like, hey, this is the takeaways, or here's what we're learning from each other. Or anytime there's a call for a speaker for ultrasound or vice versa, each other are kind of putting each other's names. It's just been really great to see kind of how their careers have transformed using Twitter. But I think, honestly, to me, promoting your work, each other's work, is kind of the low-hanging fruit of Twitter. I actually think there's a lot more that one gets out of Twitter, and I'm going to use a modified Bloom's taxonomy to help us explore that. We often think about Bloom's taxonomy with the sense of learning objectives and think about the different complexities of learning objectives. I thought we could use that framework to think about the different complexities and levels with which one can engage with Twitter. So we'll start with the bottom, which is kind of just lurking around and learning, which I actually have to say I spend the majority of my time in this arena and get a lot out of. So in terms of the space for lurking and learning, this is a interventional cardiologist from Stanford. He says, I can count at least 5 things I do differently now in the cath lab because of what I learned on Twitter. This is someone who asks any simple way to differentiate between salt-sensitive and salt-resistant hypertension and use a hashtag #AskRenal. And nephrologists are actually, like, leading the way in Twitter. They're actually kind of the internistic in many regards in this. And so the hashtag #AskRenal is actually, it sends that tweet to a bot, and that bot kind of sends it around, and all these expert nephrologists will see and kind of answer. And they're not even just answering with their own expert opinion, but they're often linking it with really good evidence. So it's a really kind of useful thing. And this is, for example, in terms of, we obviously don't have time to go to every single conference, and this is an example of kind of the practice-changing trials from ID Week this year. This person, like, is practicing good, what I call good Twittersmanship, by, like, linking the evidence to the practice-changing trials of the year to know. But if you think Twitter is just a space for learning clinical medicine, that is actually, to me, just scratching the surface surface, there's a lot of kind of learning in terms of professional development. This is an example of Dr. Manning, who's a professor at Emory, and she talks about end of rotation feedback. And when she was a trainee, she was told, your presentations were disorganized at times, and I expect students to be more independent at this point. You have some gaps in your knowledge, and I would encourage you to read more. And she goes through a whole thread of kind of the back and forth between this attending and her when she was a trainee, and kind of all the small talk that had happened. And then she goes, you know, my issue wasn't the feedback. It was not. It was that you saved it all up for a sucker punch at the last day, offering me no chance to autocorrect or step up, using all your breath on queries on who has the best Korean barbecue and how I felt about the new Lion King movie. I think what proceeded from that was a really interesting discussion from all these medical educators on how to give feedback, how to approach it, especially when the inertia of Feedback Friday is so real. That's just one of many examples of professional development that discourse that's happening on Twitter. Another space of learning is just kind of hearing other people's narratives that you might not hear otherwise, and particularly in the realm of interprofessional education. And so this is an example of I think it was last Thanksgiving. I was on service on the long weekend, and that Monday I had about 4 patients on my service who were NPO for a procedure. And at 4 p.m., unfortunately, almost all their procedures got canceled. And yes, it was really unfortunate for my patients who had to be hungry all day. But it was also unfortunate because one of the family members was really upset and yelled at my resident for about 10 minutes straight. And it just felt bad because she got the brunt of something she had absolutely no control. How do we prevent this in the first place? So I actually tweeted on my way home that day, and I said, pain point in medicine, one too many patients whose surgeries get canceled after being NPO all day. And I tagged some surgical colleagues and said, what could we do? I actually don't know these people, but I know they're surgical specialists. And actually an anesthesiologist from Thailand was the first person to reply back. And he said, actually being NPO for too long increases aspiration risk. Obviously it's hard for a patient and everyone involved. The better way is to drink clear, non-carbonated liquid for 2 hours before anesthesia. Drink as much as you wish. And I just was perplexed. I said, oh, I never heard of this data of clear liquids 2 hours prior to surgery. All I've ever known is NPO before midnight, right? That's like a knee-jerk reflex. And I said, hey, do you mind sharing with me the data? And actually, I want to say, so many surgeons and anesthesiologists kind of piped in with the latest data and things. And then actually, interestingly, a few hours later, this is a hospitalist from Kentucky who said, hey, actually, 2 years ago, we published a paper just on this where we changed our orders and we had many less patients who were fasting because we changed our orders based on these latest recommendations. And then a day or two later, there was a resident who kind of summarized all the teaching points that the surgeons and anesthesiologists had said into this nice infographic. And I mean, while all this is great, I think at the end of this just blew me away because in our busy departments, we don't have the chance to have these conversations. I don't even know who the surgeons and anesthesiologists for these small patients were to be like, hey, how can we prevent this in the future? But Twitter is giving us a space to have this interprofessional dialogue, and often it's done in a very respectful, non-defensive inquiry manner. And so that's a learning kind of where I think I get a lot out of Twitter. I mean, the next level up is supporting. And this is on Twitter would be liking or retweeting, and I'll show you exactly how to do that. The way I think about this is like my vote, right? This is like, I want this message to be amplified in medicine, or like my sense of sponsorship, where I want this person to be more visible. I want this message to be more visible. That's how I think about that liking and retweeting. And it's interesting, in prepping for this, when I went back and looked at what do I retweet, it's often stories of grit. And I think it's because, to me, that's a value that I want to surround myself with. I want to surround myself with people who are just incredibly resilient. This is an example. This is the green button is kind of how you tweet. It's green kind of rectangle with arrows. This is an example of someone who's a researcher, and he kind of posted a graphic, and in the purple is all his funded grants, and in the red is all his unfunded grants. And then similarly, this is an example of a bariatric surgeon who posted a paper that she had just published, and yay, celebrating that. But then she had a whole thread of the back and forth of the year of submit, resubmit that she had to do, and the insights she learned along the way. And I think it gets back to kind of my value in medicine, where I really care about a space for vulnerability. I think if medicine truly cares about being an inclusive workforce, it needs to allow space for people to be vulnerable and for other people to have access to those insights, or we're just going to kind of perpetuate this like unattainable academic ivory tower. And so Twitter is really kind of creating a space organically for people to find support, whether it's academically or in other issues and areas of medicine. So kind of think about what are the messages you want to support. It doesn't have to be, obviously, stories of grit. There might be something else that speaks to you more. Higher level up is, in addition to liking and retweeting, would be actually to be part of that conversation, right? Applying what you yourself have experienced and analyzing and actually replying back. And I often do these in something called Twitter chats, which I'll talk about in a second. This is an example of a Sunday night women's medicine Twitter chat where we talked about strategies for being organized in work or school. And I had talked about, usually on Sunday nights, I usually do a matrix of important versus urgent tasks for the week. And the hematologist in Mayo, she actually put up this matrix she asked her fellows to do, which actually organizes it into effort versus impact. And I actually now have changed what I do, because too often I found like everything went into the urgent, important column, or like the non-urgent, important column. We kind of stayed there, and kind of organizing into effort versus impact makes it much easier to separate out and think about where my energy, my intention is for the day, and I can kind of organize myself. So in terms of joining the conversation, being a part of whatever kind of speaks to you. And then last but not least is kind of actually being someone that creates the discussion. And there's so much variation in terms of how to do this. The most kind of prominent example is that digital scholarship aspect that I was talking about earlier, where people are using Twitter as a teaching tool. This is an example of Dr. Twibe, who's a hepatologist at Michigan, and he did a whole Twitter threads of multiple linked threads on kind of how to do pain control for patients who have cirrhosis, or Dr. Brew. He does very interesting pathophysiology questions. You know, we know amlodipine causes edema, right? Great, but how does amlodipine cause that edema? It goes through kind of 17 threads that are very, very well researched and referenced in terms of the mechanism. And this is what I mean, that it's not, a lot of this stuff on Twitter is not as instant, and it can take days of research and kind of putting together a thoughtful thread. And in addition to the space to create discussion on, like, as a teaching tool, there's a lot of other discussion as well in terms of, like, for example, how to write a good letter of recommendation, how to write a good personal statement, and so people are really kind of making things their own. The point I kind of want to bring out is that by creating these discussions, there's a real potential to inspire curiosity and for people to feel that passion for medicine. This is what Dr. Brew said in a perspective piece in New England Journal about a few months ago. He said, if used correctly, which means not just as a broadcasting, hey, look at the cool things I'm doing, but if used correctly, Twitter can be a haven for physicians who hope to rekindle and stimulate the curiosity that made them choose a career in medicine. And similarly, I can't emphasize enough Twitter as a space to amplify culture change. This is Dr. Silver, who's really kind of one of the leaders in the gender equity movement, who says social media may provide female physicians with the opportunity that previous generations lacked to express their opinions, insights, and vision for the specialty. And I think we know one of the biggest factors that leads to culture change is constant conversation. And it keeps these platforms help keep people from doing lip service to things, and keep these issues on the forefront of people's minds. And I feel very strongly we would not be where we are with gender equity if it hadn't been for these platforms. There's still so much room to kind of improve, and I think these platforms will continue to be instrumental. This is an example of, in terms of culture change and the tribalism that happens in medicine, often between the primary team versus the consulting service, or vice versa from the consult team to the primary care team. It's interesting, after I tweeted this, cardiology fellow had messaged me and said, hey, I saw your tweet earlier in the day, and it kept me from snapping back at an intern for calling me for nonsense chest pain. And while I felt happy about that, I don't know if he would have kind of made that decision on his own if he hadn't seen that tweet. And again, it's hard to really measure the ripple effects of these conversations and how it's helping people kind of be better versions of themselves. But I think the impact is quite felt. And so maybe you're thinking, okay, great, it sounds like there's fruitful discourse happening on Twitter, but what's in it for me? And so if some of the discussions haven't kind of been enough for you, I think there is this strong notion that more and more institutions are actually thinking about one's digital footprint into their academic promotions and tenure committees, and thinking about kind of how to make this work count as scholarship. This is an example of Mayo Clinic, where they list very clearly kind of low impact, medium impact, high impact, and what counts for promotion in this regard. And then also just thinking about medical education in 2025, a lot of the thought leaders say this will be a part of everyone's job description as a medical educator, to be a digital mentor and a digital curator. So even more reason to be a part of this conversation, kind of understand what is out there and what our learners and our colleagues are kind of interacting with and learning from. And so maybe you're like, okay, this is great, but how would I even start, right? Like, how would I even insert myself into all of this? And so I put together like 10 quick steps. I'm going to go through them relatively quickly, but I would welcome any questions at the end. So number one, I say just give yourself a few months and look. Just open up an account and just kind of see what you like, what you don't like, and try to follow people that might interest you in whatever kind of medical education, health policy, research, and just kind of lurk around and get a feel for things. No pressure, just for a few months, just kind of feel it out. While you are lurking around, please do not be this egg person, or I don't know, it's a gray person, I don't know what you call it, but I made this mistake because while you're kind of lurking around, you want people to kind of know who you are, and the reason why I say that's really important, like in terms of putting up a picture and putting up a bio, is because those 280 characters of your bio is really like the new CV cover letter in the digital space. And another reason why it's important is because this is how people find you. For example, if I'm looking for a speaker for a podcast or someone to peer review something, yes, I'll see who's published on clinical reasoning, but I'll also look at hashtag clinical reasoning to see who's on Twitter. I can get a better sense of who this person is and who I want to speak. And it's not just like for me and kind of the podcasts that I work with that do this, but even at national meetings, people are kind of looking at the same exactly and looking at your digital footprint. And so think about the hashtags you use in your bio is my takeaway, because that's how people will find you and your expertise. The other mistake that people make is they'll just do their bio, but they'll forget about the 3 other places to really share their mission. And so there's this cover photo. This is Dr. Rainey from Brown. She's very passionate about gun violence. So actually her picture reflects like blood. If you're someone who's like very pluripotent, has multiple interests, a place to kind of show any different interests that you have in your cover photo. Obviously, if you are someone who's published extensively in a field, like please put your ResearchGate or your Google Scholar link, and then there's also a pinned tweet, which is one of the first tweets that people will see, and so another place for you to kind of show like what is it that you care about. And then number 3, like I can't emphasize this enough, another very big rookie mistake is like do not tweet into the void. Twitter is about conversations. And so really, if you're going to start with Twitter, it's really about replying back to someone or retweeting with a comment of something that interests you. But tweeting into the void will kind of lead you to disappointment. It's better to kind of have conversations and start with that connection first and foremost. And this is, I kind of pointed out how you would reply or how you would retweet and comment there. Number 4, find your tribe or your Twitter tribe. I say this because think about if you come to a new place, just any new place, you are not going to be comfortable until you get to know people, right? That's just human nature. And similarly, if you're going to try Twitter out, you need to get comfortable with people and kind of comfortable saying things. One of the biggest ways to do that is these Twitter chats that I've mentioned or these online journal clubs. And what they basically are is that they're a dedicated time, and people like that because it's just a dedicated time of like 1 hour, where if it's a Twitter chat, there'll be 4 questions within that hour, and you follow a particular hashtag. So for example, this is the Women in Medicine Twitter chat on Sundays at 9 o'clock, and this handle will tweet out 4 questions, and then you reply back to them, but you also get to know what other people are saying around the country or the world to that question, and you get to kind of build those connections. There's also a primary care Twitter chat on Thursday nights, every other Thursday night. And then Journal of Hospital Medicine actually gives C&E for they'll pick one article in their journal on Monday nights think at around 9 o'clock Eastern Standard Time, and then you get to interact with hospitals around the country, and it's actually really fun and a good community. And there's also there's so many chats, but this is another one one of my colleagues at NYU started, which is a humanities chat. So very different depending on your interests. There's lots of places to kind of get to know different people in internal medicine. Number 5, be authentic. And so I say this because I showed you examples of what other people have done on Twitter, but that doesn't mean you can't be yourself and kind of create your own dialogue. I say that especially because if it's something that speaks to you, I'm sure other people will also kind of be excited about it too. This is an example of a resident who said, I volunteered to coach new interns at Night Club. I showed him where the microwave was and told him McDonald's is the closest 24-hour coffee source. Then my co-resident gave them a really smart spiel on NSVT. My teaching was less impressive, but I'd like to think it was important as well. And so, it's all do a tutorial or a thread on NSVT. You can just speak from your heart, and it's resonates with many people. Number 6, so how do you be authentic to yourself? My biggest advice is to think about what you do on a daily basis and try to make that count twice. So if you're someone that's, on Saturday mornings you read journal articles, or maybe you don't do that on Saturday morning, maybe you do that another time. But if you're someone who likes reading articles, highlight that. This is an example of Eric Topol, who's he's a cardiologist who's on Twitter. He literally highlights the articles he reads and puts them on Twitter, and makes it count twice. If you're at a noon conference with some interesting teaching points that other people will learn from, tweet that. If you're perplexed by a question, which, for example, why do all these people's surgeries get canceled at 4 p.m. and why, ask your Twitter friends about that might be more knowledgeable. Just think about how you can make things count twice. Number 7, I can't emphasize this one enough. When you do make things count twice, be very thoughtful about how you craft your tweet to meet your goal. And I say that because, I'm going to use this as an example. I made a fake tweet. So say, for example, I was at a really phenomenal talk on how to give a talk by one of my mentors, Dr. Lyra Horowitz. And so maybe I tweet that, be like, hey, look, how great of a talk this was. Think about if you were in Australia or if you're in California and you see this. What are you going to feel? You're going to be like, oh, sounds like another great thing that I was missing out on, right? You're not getting anything out of seeing this. And so think about kind of what message you want to get across. Instead of tweeting that, I actually tweeted, something that was really compelling from the talk. I said, game changer on how to present charts in an audience-friendly way. First, just at the audience, then show the bars, then show the trend line, and then last, animate the takeaways. I actually didn't have to say that last line that it was a great talk because the teaching point was important enough. And this goes back to this idea of social network versus virtual community. So the first one is hey, look at this great talk I am at. But the virtual community aspect is, here's an important thought that I think other people can add to, right? Someone else could add their own teaching points on how to give a great talk and animate slides. Someone can kind of learn from and connect with the left-hand side, the virtual community aspect. So just think about kind of what you're tweeting out and how you can use it to connect with other people. Number 8 is when you do tweet, tag that Twibe or Twitter tribe. And I say that because just as you need sponsors in your day-to-day, having people that can amplify your message is important. But also, I think no matter how many followers I have, I still actually tag people either within the tweet or in a linked tweet. Because if I'm taking the time to ask a compelling question that I really care about or share something that I think is really important, I want to see what other people who might be interested in that same topic genuinely think. And so do not be afraid to tag people to really start that conversation. It's something all of us actually do. Number 9, practice good Twittersmanship. So rethink before posting something. This is actually the social media policy from Mayo Clinic that says, don't lie, don't cry, don't cheat, don't delete, don't steal, don't reveal. Always presume that HIPAA applies. And another way to think about it is if you think about before tweeting, think about if your boss were to read it, if one of your colleagues were to read it, and one of your patients were to read it. That's actually just a good rule of thumb. And number 10, dare to imagine. Again, I showed you what other people have been doing on Twitter and other ways that people have been inspired by Twitter. And so it's a really evolving platform. years ago when only emergency medicine folks were on it was all about like, here's the latest cool trial. It was all about that. I think as more internal medicine people are engaging with Twitter, it's really become more of a narrative, reflective space. And who knows, in a year from now, as more smart people engage with Twitter and kind of make it their own, it will probably evolve to be different as well. And so with that, just some takeaways. Again, not all social media is the same, and you choose what type of social media you want to be a part of. I choose to be part of more of the virtual communities and digital scholarship because I think I benefit and become a better physician from it. And just like kind of papers and professional meetings and classrooms, we have these virtual communities. None of these mediums are perfect, but they are a medium to really amplify our larger mission and better ourselves. And then just some takeaways that the Twitter community wanted to share with you. This is Dr. Preface from Northwell. He says, tell them that there's only so much siloed clinical research, practice admin stuff you can do each day. But the power of 20 to 30 minutes of smart camaraderie, seeing landscape, leveling hierarchies, hearing from other professions, sharing QI, educational, and clinical ideas, I think he says was powerful. There's some verb that's missing there. This is Dr. Bin Kopp. She's a Chief Innovation Officer. I forget where exactly, but she's like anything else in life, you get out of it what you put into it. If you create meaningful personal branding, you're selective with your contribution, you will be rewarded with interprofessional connections and thought-provoking content that will enhance your career and your life. It's a tall theme, enhance your life. But I think it's something that's true for me in the last 2-3 years of just engaging with Twitter and how much it's kind of changed my view on medicine, giving me a space to really think about how to create change. So with that, I'll take any questions from the audience.
We talked a lot about sort of individual activity on Twitter or engagement with Twitter. Curious like how you see, or if you like role for like a practice group like our group or like a division, like not just like that look like we have a Twitter account, but to like actually make that meaningful either for colleagues or for like patients. Just curious.
Oh yeah. I don't know about patients as much. I feel like there are a lot of institutions have Twitter accounts for patients where they're like, hey, look at this cool new research that we just did, and I don't know how meaningful it is in terms of patient perspective, but there are definitely a lot of programs in terms of where school of medicines or residency programs or divisions will have a Twitter account. And I think that I have so many thoughts on this in terms of the ones that are doing it well are all like the same thing. They're not just like, hey, look at what we're doing, but they're engaging with other institutions in terms of like, oh, this is your project EGIM this week, this is ours, or here's an interesting case that we saw, and like we'll invite other people to join in on that like really interesting M&M of that week or something like that, which I think is a really great way to use Twitter and kind of go outside our institutional boundaries in terms of let's share and really kind of think about how do we elevate us as a whole medical community. The other thing I want to say is, this is anecdotal, but I think people have been really, senior leaders have been really amazed to see the power of Twitter. For example, I will give you an example of a residency program in the Midwest. It has a lot of money, but has a hard time recruiting female residents and like a couple other goals that they wanted to meet. And actually, they hired this program director specifically to help with recruitment. So for 7 years, every single recruitment season, they like reiterated the recruitment to like, capture a really diverse group of residents. Couldn't meet those goals. They started a Twitter account about 2 years ago, and they were very genuine with like kind of what support and resources they have there. And it was the very first year they were actually able to meet their metrics. And so, I shouldn't say metrics, yeah, but it was fascinating to me in terms of how those messages you can spend thousands and thousands of dollars on your recruitment day, or you can consistently reinforce like, hey, we're the supportive place and we want to like recruit diverse people, and here's what kind of resources we have. And so it was just amazing to me to see that. I keep hearing more and more stories how it's changed kind of recruitment, but also kind of people seeing these institutions that are on Twitter as really leaders in X, Y, and Z. Because it's what is visible, right? Yeah.
So I'm not on Twitter, and I'm curious about as far as like navigating it, because All these things is all about like how you like make your way through this morass of information.
Yeah. In terms of navigating it, in terms of
Like lurking.
yeah. After you start a Twitter account, and make sure your handle isn't like some, make it be your name and MD or whatever kind of initials. And then Twitter will suggest people for you to follow, but I think you probably know people that you're like, what is your interest, by the way? Maybe I can.
Primary care.
Oh, yeah, primary care. So maybe joining the primary care Twitter chat would be a good place to start, and you can see who are the people that are general internists who really are passionate about primary care and are really amplifying that mission. And I think you'll just figure out a couple people to follow. They'll follow you back because you'll write a good bio saying that you're someone who really cares about the primary care mission. And then and as you see kind of what things they're tweeting about. This week is especially a unique week because people around the country are telling each other why they're passionate about general internal medicine. And so to kind of amplify that message or to reply back to them, and then just taking it slowly from there as you see like, oh, I like this person. I don't like this, and then going from there. I don't know if that helps or asking more specific questions. Yeah. Yes.
I don't have a Twitter yet, but I think one of the things that always turned me off is kind of like that environment of like the YouTube comments,
right,
or like the comments under something, where it kind of seems less like a place where you go to learn new information and more of kind of like a place of kind of terroristic comment activity.
Absolutely.
And not really wanting to be a part of that. So I guess my question is like when you're using Twitter for this particular purpose, what do you see a role for yourself in combating misinformation?
Yeah.
And does that take away from your actual mission?
Yeah, couple thoughts. So one is like you really create your own bubble on Twitter. Like I only follow people who are like talking and sharing about things that I think are productive and have a similar mission to me. So actually on my feed, really rarely do I get this like, I don't know, I should just put political things in here. So I don't know anyone's view. So, very rarely do I get these things that would really kind of like trigger me, if that makes sense. So one, it's very important in terms of like you're creating and kind of curating your own bubble. And also, I can't emphasize this enough in terms of the medical community on Twitter is not these trollers, right? Even the cardiologists, sometimes they're probably the closest to like, they're not trollers, but they're really hardcore about, they're like surgeons with regard to how much, if someone publishes a cardiology paper and like the ischemia trial, they will like cut it apart if it wasn't the most perfect trial. But they've created that community where it's like, we really care about evidence-based medicine, and we really care about what the takeaways are and what the flaws of a trial are. And that's their community they've created. That's like a norm for them. But otherwise, there isn't any, like, there very, very, very rarely is there ever a troll. And if I ever encounter someone who's kind of making a hate statement or something like that, very rarely, I just ignore it. It's not worth my time or energy. Who knows who this person is and what kind of agenda they are? It's not worth my time. I don't know if that helps in terms of just thinking about demystifying Twitter as a place of, like, yes, getting those random comments from people. I think the majority of the people on medical Twitter are very mission-driven.
So I run our program Twitter account, and I follow some of your advice. It's like very helpful. But it's really challenging to find patients because that's some of our target to kind of like tell them about our events or what we're doing. And I don't know if you have any suggestions on how to improve on that part.
Yeah, I'm not an expert on the patient engagement aspect of it per se, and I don't know if it's like really kind of just publicizing to your patients that we have this kind of community. But then also I think you have to target your account in terms of what you're sharing, because you have to share either to a lay audience or you're sharing to a more sophisticated clinician nursing audience, right? And so if it's to the patient audience, then I think maybe it's just publicizing to them that we have this space in place and what like, is it putting it in the bathrooms, or I don't know if you get creative in terms of how to do that.
And I think we have kind of like a mix of both, actually, as you're saying that, professional, but also other community-based organizations. Yeah, I think
Yeah, it's,
that piece is
yeah, so
really
it's, I mean, I feel like what I see mostly is like there'll be an academic division of medicine group, right, which is more about like, let's amplify our faculty, let's like share like the innovative things that we're doing and learn from each other, and then there'll be like hospital Twitter account, if that makes sense, and that's more, I think, geared towards the patients about, look, we did this like amazing new lung transplant this week, like come to our, and I'm less well versed on kind of that patient market. That's patient marketing, right? Yeah. Thank you so much for